This is the Situation Room, the only way to start your day.
Okay.
And it can be caused by several causes, including other infections like bacteria, alcoholic, but the most is viral hepatitis.
Mm-hmm.
And we talk of viral hepatitis, we have 5 different types characterized today.
Mm-hmm.
We have hepatitis A, B, C, D, and E. It's important to note that hepatitis A and E are enteric, meaning that the route of transmission is orophycal, that you can get from contaminated food and water. When we come to B and C, which is of interest in Ministry of Health Kenya, it's because it can be transmitted by infected blood and body fluids. And also, more importantly, the other 2, A and E, are self-limiting. But B and C can cause chronic infections. And it can lead to liver damage and a premature death as well. So, to your answer where we are, let me also again start globally. This is a silent epidemic that is causing public health threat, which is acknowledged by the WHO. We have millions of people living with chronic hepatitis, and of those, very few know they are infected. And we only have a few of them, like 13% of the 287 million who live with chronic hepatitis that are on treatment. And a few of them know that they are, because we are calling it a silent epidemic. By the time you come to know that you have viral hepatitis, it means that your liver damage is advanced. You're already into cirrhosis and to hepatocellular carcinoma. Hepatocellular carcinoma is a cancer of the liver, which is second leading cause of death globally. And the epidemiology now, to answer your question, mirrors, the Kenyan epidemiology mirrors that of the world or global, where we have a pooled prevalence according to CAMFIA 2018 of 3% in the country. However, we have regionally some regions with high burden, like northern part of Kenya with 7.6%. We also have Nyanza region 4.6%, and we also have the North Rift, which has also over 5%. But again, if you go to county by county, there are counties which are reporting very high burden. Start with Turkana, 16.8%. Come to Baringo, 11.8%. And we also have, those are for hepatitis B, majorly. And then we have the Nyanza region, which has co-infection, that is HIV with hepatitis. We're also reporting very high. And then when we go to the coastal region, we have hepatitis C, which is mainly acquired through blood by using shared needles and syringes with those who inject drugs. And then we have Lamu, 29%, and Mombasa, around 26%, and Nairobi, because of its cosmopolitan dwelling, we have around 12%.
No, Dr. Those are very alarming statistics you're giving, because it means we have scores of people walking around with a major organ that is not functioning as it should. And I think liver is one of, all organs are vital, but liver is one of the most vital organs that you need functioning for you to be at your optimal health. Now, you mentioned the types of the hepatitis. And you mentioned that there is the orophycal, and then the other one through, body fluids exchange. So, especially on the orophycal cause of hepatitis, it sounds like something we can avoid. It sounds like something government, institutions, communities, families, individuals can do something about. How have we grown to such high scale of prevalence, given the statistics you have mentioned? Yet, I would imagine there are organizations, ministries, agencies that understand the causative agents of this disease, and therefore they can have some mitigating measures, but we don't have that in existence.
Yeah, thank you. Let me correct something. Hepatitis A and E, I said, is orophycal.
Right.
It's self-limiting. We have vaccines for A, but you don't have vaccines for E.
Okay.
They are self-limiting, meaning that they cause acute, and the body can take care of them. You don't need to worry about putting people on treatment.
Okay.
And I went ahead to say, as a ministry, we're concerned with hepatitis B and C because these are the ones which cause liver damage.
Okay.
They can lead to chronicity. And you live without symptoms to 20 to 30 years before you get the symptoms like jaundice. And by the time you are coming with those symptoms, your liver damage is advanced. Yes.
I mean, you know, Dr. With just the stats that you've given, one would then look at perhaps initiatives that have been put in place in terms of if it's vaccination being one way to address the problem, right? But then again, even before we get there, for individuals who have poor seeking behavior, tend to appear before doctors, at the last tail end when the disease is finally has permanently put them on bed because then their organs are failing. How would you address ourselves to poor seeking behavior and how it is leading to more disease burden in the areas that you mentioned?
So public awareness is one of them, using the communities to create awareness. And that's why we have days like World Hepatitis Day, to create awareness.
When is that?
Screening.
When is the day?
On 28th of July, this year we are commemorating it in Baringo County. And as we speak, testing and awareness began a week ago, and we are intensifying that. But to answer your question, as the Ministry of Health through NASCOP and the VH section, we are mandated to provide guidelines on the treatment of hepatitis. And recently we have launched the integrated guidelines for HIV, hepatitis, and STI, which gives guidance on how to approach, giving an entire package, continuum of care, starting from awareness, screening, testing to diagnose, and also linkage to care. We are embedded in the HIV, which is a robust, well-defined, grown, mature program. And as we're approaching integration, the viral hepatitis, we want to leverage on existing platforms to ensure that there is screening. And more importantly, the mother-to-child transmission of hepatitis B is the one which is the driver for chronic hepatitis, because 90% of those kids who acquire in infancy will transition to chronicity. So what the ministry through NASCOP, what we have done is to ensure that each mother who comes to our antenatal clinic, or those mothers who are pregnant and come to our antenatal clinic, get to be screened for the 3 diseases, because we have an entire section that deals with triple elimination of HIV, hepatitis, as well as STI. And they are tested. And once you test positive for hepatitis B, you are now put on prophylaxis to prevent the child, to prevent the future generation. But the mother also, as an individual, has to be checked whether she's eligible for treatment. So you start with herself and put. And once now she comes back to the hospital again, or the facility to deliver, we do have the birth dose. That universal birth dose is envisioned in our treatment guidelines, that any child is born in Kenya should be put on birth dose vaccine. That is hepatitis B birth dose vaccine, followed by the pentavalent that is given at 6 weeks, 10 weeks, and 14 weeks.
Is this intervention available in all clinics whereby a pregnant mother, a pregnant woman in that case, goes for their prenatal service or care clinic? Is this service, is this intervention available in all government clinics today?
The screening for hepatitis B, that is viral hepatitis surface antigen screening, is available. It's provided through NASCOP, and it's available, and all the mothers are screened. And more importantly, we are seeing the ages of 2024, we're not seeing much positivity because the vaccination, the pentavalent that I was talking about, that is given 6 weeks, 10 weeks, and 14, was introduced in Kenya around 2023. So those people who are 20 and above, around 20 to 24, 25, thereabout, have been vaccinated, a majority of them. And the ages, advanced ages, the mothers who are coming ANC advanced ages are the ones that we are seeing a lot of positivity.
Doc,
there.
hepatitis is regarded as a silent disease, right? But that notwithstanding, then there is the aspect of we must go to get screened. But what symptoms are there for one to pick up that perhaps this could be hepatitis?
The symptoms are there, like jaundice, but and the other ones are these normal ones: the fever, the nausea. Those you might not differentiate from other diseases, what we call differentials. However, you might not, by the time you get those symptoms, like I said, you have an advanced disease. But what do we do? Prevention is key. How do we prevent? The vaccines are available. We don't have to invent the wheel. This vaccine preventable, and it's treatable for those who are diagnosed, and the screening is available. So what we are doing is to advance awareness and advocacy, and to get the buy-in from the political elite to ensure that these services are available, and integrate these services to the routine healthcare services in our primary healthcare as well as universal healthcare.
I like the fact that you've now brought in integrating these in primary healthcare then, because there have been conversations around vaccination for a very long time, and you'd find that there are those who are pro, there are those who are anti. So perhaps then to break it down to just the importance of vaccination being part and parcel of conversations for mothers, for children, and anyone who's getting into a hospital for any treatment, that this is part and parcel of screening that is done because you want a population that is healthy. Are these conversations that are taking place for the citizenry to understand why when you walk in, perhaps screening for hepatitis would be on the table?
Truth be spoken, we are not yet at that level, but we are moving towards that. We are building the structures. You know, when you have policies and you have structures and you have the will and you have the political goodwill, then it's easy to get there. Our mandate as of now is people to create that awareness that yes, hepatitis is with us. Yes, we do have the burden, but the good thing is it is preventable, it is treatable, it is manageable, and for the cases of hepatitis C, it is curable.
Who qualifies for vaccination? At what point do you say, can anyone, like even a newborn vaccinated, a 50-year-old vaccinated, who qualifies? At what point do you say, we wanted to vaccinate you? Because many are asking, can I wake up today, go and say, I want to be vaccinated?
You cannot just wake up and get vaccinated. If you are an adult and you've never been vaccinated for hepatitis B, we're saying get tested. Know your status today. Hepatitis is a silent killer. Once you know your status and you are negative, then you are eligible for vaccination, adult vaccination, which will be given 3 doses. And 3 doses at different scheduled times. And then for the infant, that's a good question that you ask. For those infants who are born, the mothers who have been confirmed, like I said, we're screening for hepatitis for all our pregnant mothers who show in our clinics. There are disparities for those who will come late, for those who will deliver at home. But a majority, now that we have CHAS who are bringing the mothers, and we are advocating for all pregnant mothers in this country to get skilled delivery and attend as early as possible to our ANC clinics for them to be screened for not only hepatitis, but the 3 diseases and other infections. Because we're looking at this person in a holistic way, not a disease specific, as we're moving to integration. Even if today the center is hepatitis, but we're looking at that woman as a holistic individual.
Now, you know, there's the other lot. So you have the newborns, the new mothers, but then you have the adults who have various life choices, are suffering like liver cirrhosis because of overindulgence, maybe of drinking. The intravenous drug users, you say the injection and sharing of the needles can cause like hepatitis C and all that. How is the prognosis? Is much is a pandemic? Is this a disease that you can be treated and cured from, you can recover from? What is the resilience of the liver? We've had, I don't know that it is overrated, but it's one of the most resilient organs one has. How factual is that?
For hepatitis C, there are active antiviral therapy that are taken for 12 weeks, and it is totally curable. For hepatitis B, like any other chronic illness, it's not a curse. These are just a medical condition.
Yeah.
Once you are tested and you are diagnosed to have hepatitis, and your level of liver damage is ascertained, you put on antivirals, like what we're calling tenofovir, only a single drug. But in Kenya, we are using a combination of two for life. Okay. Now we have to prepare you that you need to adhere. And we've seen if your viral load isn't that low and you haven't gone into severe liver, then the prognosis is very good. That you can reserve your liver, that vital organ. So we encourage people who are tested to go for medication. This is not a killer disease per se, as it's misconstrued, but chronic manageable disease like any other.
And in terms of treatment, because it's the beauty of having experts is that we can demystify some of the theories we have around these conditions. Yeah. If one has hepatitis B, can they get a liver transplant, and would that address the condition?
Is it curable?
Is it curable in that sense?
For sure, medical or medicine has advanced. Yeah. So if you have totally liver failure, then a transplant might be an option, and it is available, though costly, and it functions. That's an option which is available. Yes.
Yep. I mean, you see, there are different ways where hepatitis becomes a burden or someone gets infected with it. And one problem there is exchange of fluids. So how do unsafe sex predispose individuals, especially the young people, on getting infected with hepatitis? How much a burden does hepatitis B where unsafe sex is the order of the day?
Thank you. That's a very valid question. Hepatitis B is sexually transmitted. If you have unsafe sex, then if you have unsafe sex with a person who is infected or doesn't know their status, then your chances of getting hepatitis is high, because it is transmitted through body fluid, blood and other body fluid. That's why we are saying prevention. A combination prevention, not vaccine only. Have safe sex, protect yourself, use condoms, and the more individuals who are at risk are those with multiple sexual partners, unfortunately, and those are the ones who must practice safe sex. And we are seeing our adolescent and young people to be in this category. I was saying we are seeing low positivity because they got the vaccines, but we also prevention is better, a combined approach.
So when we look at reports coming from government that we are recording more HIV cases, say in Nairobi, among the young people, is that as well an alarm bell for doctors as well when it comes to the burden of hepatitis in the society? Because then again, HIV, how is it transmitted? Through unsafe sex. So when we see numbers of HIV going up, that in one way or the other would as well inform what needs to be done to address hepatitis. Would I be right?
We can use that one as a proxy,
but
unfortunately, viral hepatitis is more virulent, 100 times more than HIV. Okay. So we are more worried with hepatitis B as opposed to HIV. But HIV is more pronounced, and people speak about it, and people have knowledge about HIV, including our healthcare workers. But when you speak of hepatitis, very few know that it even exists, or even how to handle and how virulent it is. But it is virulent than HIV, and it can cause more infection than HIV, and it has more people who have mortalities or death than HIV, even globally. But unfortunately, less is done if you compare with respect to HIV, including advocacy, awareness, and also the resources that are put towards HIV if you compare with hepatitis.
Yeah. I know Kamanya has a question, but let's take a short commercial break. We look at the weather and traffic, and when we come back, we continue with these in terms of as well, just making sure that we are able to address the issues at hand at exactly 32 minutes after 9 a.m. Good morning.
This is the Situation Room. This is the Situation Room. The only way to start your...
If you see, jaundice has been there, and there are other diseases as well, which causes jaundice as well, that affect the liver. So, but since 2015, the WHO has been advocating for member states to align with strategic, the WHO health sector strategy to eliminate these three diseases. And yes, it's been here with that. It's only that the fact that you live 20 to 30 with asymptomatic contributes to many governments and partners and healthcare to actually put effort in those which are fulminant as opposed to this silent killer.
So just to bring in another dynamic, is tetanus part of this, or is tetanus a totally different condition? And does it affect now can it lead to or cause hepatitis?
Tetanus is caused by a bacteria.
Okay.
And mainly affects the skeletal muscle, and had nothing to do with the liver, although it can exacerbate.
If one has, it can. Okay.
Yeah. I mean, there is affordability of the treatment, which then is another concern for many, because there is the factor, treatment is expensive, we also don't have so much knowledge about it. And many say the diseases that have little or no information are the most expensive to deal with. So many would say, I'm feeling nauseated, but I'm gonna just go to over the counter and deal with that. Yet that is a symptom. I'm having a problem with my libido has gone down. Nitaenda kwa daktari wa mitishamba, because you know what? That is where we resort to. How expensive or how affordable is it to treat hepatitis?
Start with the myths that you brought
Yeah.
in. We want to demystify the myths that hepatitis, or when you get a symptom, you just go to mitishamba.
Yeah.
And that's why slowly people have been dying and dying, and especially the rural area.
Yeah.
And there is a big connection between education and viral hepatitis transmission. We are seeing high burden in those people with low or no education at all. It also socioeconomically, for those who are living crowded areas, because hepatitis B has both vertical transmission and horizontal as well. We're seeing a lot of familial transmission. So having said those conditions, the treatment, because it's not known, people are not aware that this is a disease that can be cured or treated and managed, and therefore they don't seek treatment or screening or testing earlier enough, and thereby not resorting to conventional management. But you want to say the treatment of hepatitis it's cheap, especially hepatitis B, where we're just using a single molecule that will cost us $23 to $34 per person per year. And for a government, that is not much if you consider the quality years of life that will be lost once you have chronic hepatitis. We can prevent this one because chronic hepatitis becomes expensive to treat because, of course, you will require transplant and all that once your liver fails. And also now the healthy years I'm talking about, the person, and economically, those are the years that can contribute to the economy, and we're losing that. So we can look two angles: intervention and how many years of quality life that individual gains, or the country, or the population, or put intervention and see how many years you gain and how many economical gains that we have. So these are two scenarios. And a good government will go to intervention arm, where you put interventions, and we have 5 types of interventions. Key, like prevent. Because hepatitis B is preventable through vaccination and other preventive measures, but more importantly, vaccination. That is the infant birth dose vaccination, and then continue with pentavalent. And those adults who will test negative, put them on adult vaccination, and you're done with that. You've contained the transmission. And for hepatitis B, C, for instance, it can be eliminated because it's curable. And educate and create awareness, the preventive measures like harm reduction, safe use of syringes and blood products to be screened before transmission. Then we're coming to test. Ensure that you are screened and tested. And if you are diagnosed, this is not a death sentence, you can be managed. And then the third is treat. Put those individuals who are eligible for treatment, and the treatment, like I said, it is available through the HIV products for free. And because we've not gone to procure for the general population. And that's why we're urging our government that this Wanjiko who is coming pregnant and she is screened and treated, she has left a sexual or sexual partners, a husband or a sexual partners, and we need to screen those ones, because definitely by the time she's coming with pregnancy, we know she has had unsafe sex. And therefore, that sexual partner or the husband is of concern for us to know his status and link him to care if he's already infected, or prevent if he's still negative. Then thirdly, we need to track our progress. Create a robust surveillance system, so that when you ask me what is your prevalence, I'll not quote Kempfia 2018, but I will give you real-time data that this is where we are of today or yesterday. So a robust surveillance system, reporting that can trickle from the facilities where the diagnosis and testing and screening is going on, which can feed to the National Data Warehouse and also KHIS, so that everybody where you sit, you can access this information. And lastly, we want to partner with everyone. We cannot do it alone as MOH. We're calling upon everyone who can do something. The time is now for action. We have policies in paper, but this is the time for action. Hepatitis is here, and together we can eliminate.
You see, government has set itself out to put in place initiatives to address hepatitis and deal with it, right? So one asks the question, how are we, where are we in regards to achieving that? And what are some of the barriers that is making these wins to be delayed?
Yeah, the government has put measures. One of the measures is creating the viral hepatitis section under the Ministry of Health and under the NASCOP, and also to align itself with the WHO targets of eliminating viral hepatitis by 2030, and then put more emphasis on the triple elimination. But what I want to emphasize is that the triple elimination, the 3 diseases are not at par. When you look at it, we might eliminate new infection in HIV come 2027, as the president said, or 2030, but hepatitis B is lagging behind. You know, let us frame the burden. The burden is with us, the awareness is low, the uptake of screening is low. So this is the time for action, for us to fold our sleeves, go down to where the people are, and take screening and diagnostic, point of care molecular diagnostic, and incorporate and integrate viral hepatitis into routine primary health care. That's where majority of Kenyans seek medical services.
So for testing, what specimen do you go for? If I were to go for a test, what specimen? What do you use? Blood, urine? I mean, what do you go for?
For hepatitis, you go for blood. For the molecular testing, but we also have the rapid testing with oral and as well as blood.
And the results are instant, just like the HIV, or one has to wait?
The results are instant for the rapid, and for the molecular we use to transport the the specimen to the tertiary hospitals who can do the molecular test, but we are advocating for point-of-care molecular test. And as we're celebrating this year's World Hepatitis Day, whose theme is break down the barrier, we are breaking that barrier of transporting the specimen to a tertiary hospital, and we want to prove that the point of care where the patient is, you can be screened and diagnosed at the same time. And we are thankful to Remedy from Egypt, whose molecular tests are now placed in Baringo for this World Hepatitis Day so that we can test.
You know, you mentioned something that is very critical in terms of the concern areas. We've talked about Turkana, we've talked about Nyanza region, Kisumu, and these are communities, these are societies where people do associate among themselves. And this then brings the conversation on the role of communities in terms of awareness of hepatitis within their jurisdictions, because if it is a problem in Turkana, then perhaps the community needs to be enlightened and to take responsibility on sharing this information, looking at possible even lobbying for investments to come to these regions. So communities, how are we seeing different regions plugging into this conversation for the sake of their people?
Good mention of Turkana. There's something that is coming in all those communities. These are pastoralist communities. These are marginalized communities. And these are communities who associate themselves, as you said, the northeastern region, where we are seeing, especially hepatitis B, the Turkanas, the Baringal people. So that's why we are saying we both have horizontal and vertical transmission. And that's why we are advocating for the birth dose. Because you might give this mother prophylaxis at second trimester as she shows up at ANC. But now between the 6 weeks that she will get pentavalent and birth, this is the time that we have high infectivity and high transmission. And that's why we're advocating, we're asking our good government that, and through NVIP, the National Immunization Program, to ensure that we do have the birth dose that is envisioned in our integrated guidelines and also aligned with WHO. In Africa, only 17% of the newborns receive birth dose. But unfortunately, Kenya is yet to roll out the birth dose vaccine. So as we celebrate the World Hepatitis Days, this is a call that we need to incorporate the birth dose hepatitis. Like we are giving the BCG for TB and polio at birth. The first one should be birth dose viral hepatitis vaccine.
Why is Kenya finding it difficult to roll out this vaccine at birth? What's the delay? What's the lag?
This one probably I might not be able to answer why the delay, but I know it is in the guidelines, and once you have them anchored in the policy, that the government has the responsibility to take up that. And I know that's the direction we are moving if we want to get to the elimination targets.
You know, the challenge is that some things you cannot fully and truly enforce in terms of law. I think the best form of adherence to treatment and compliance stems from when the client is fully aware of the challenges they are facing and they are compliant, they adhere to the treatment, other than coming out as this is an obligation and you must. Today, most young mothers are happy to get a vaccination against polio because they know, they have seen. And that's why there is no much resistance regarding the BCGs and the other vaccinations you mentioned earlier. But you realize of late, especially here in Kenya, there has been sort of a new development of vaccines that the population is not comfortable with. And I'll cite an example. We had a typhoid vaccine going around the other day. I think there was also a cholera type vaccine some other time. And people don't have faith in this vaccination, either courtesy of inadequate information being out there before, or religious beliefs or cultural practices, or also people being fully aware sometimes that some of these conditions, there are other ways of preventing them. So, and this now creates a resistance on the uptake of the vaccine. How does this affect the same when you're talking about the hepatitis B?
First of all, to start with, polio. How many campaigns have we had of polio?
Many.
Door-to-door campaigns
Took a long
every
time.
year.
Many years.
So it
How many
took
years?
time
Yeah.
for a new initiative to be uptaken because there are different levels of understanding of
Yeah.
that. But for viral hepatitis, the vaccine is not universally available for us to carry out that. And that's why we asking and we crying to our government because this is vaccine preventable disease and which causes detrimental liver disease and death because it's a second killer. So many institutions like the cancer institution will come in because hepatocellular carcinoma, once you get now, you transition to the cancer institute because that's a cancer now. So call for everyone. Like Mother Teresa said, what I know, you don't know, and what you know, I don't know. But together we can do great things. And that's why you're calling upon the government at different levels, the national, the county, because health is devolved. We have the partners, we have the community. Everyone has a role. Let's come together. Let's campaign. Let's put innovations which are already there. The good thing is the innovations for viral hepatitis are already there, and all we need is to partake and have that goodwill so that we can carry out. If you remember very well, in the 1970s, there was kick polio in the world.
Yes.
Not polio, smallpox, sorry. And now smallpox is something of the past, and that we don't have to even vaccinate or care about. And I envision is to see that a world which is free of hepatitis, if the correct decision is made and made it now.
I think even polio, there was a campaign for kick polio sometimes during a World Cup somewhere there.
Yeah.
So I agree. It takes a lot of time and effort and convergence of ideas on how to best penetrate various setups because you have culture, you have religion, you have foods as well that could contribute to immune system and otherwise. But I'm just wondering, what, in your opinion, if you have the stats for it, what's the level of child mortality courtesy of hepatitis B, which goes unattended from the mothers because of the infection?
So generally, the mortality is high for hepatitis because 12% is the global contribution of children who acquire through mother-to-child transmission. However,
do you have a local Kenyan statistic on that?
However, once you acquire, the chances of you transiting to chronicity is very high, 90 to 95%. But you need to take 30 to 20 years.
Yes.
So by the time fatalities occur, you're already
An
30
adult,
years and
yeah.
above, an adult.
I mean, Victoria, you see, in this conversation, one thing that needs to be pushed more is preventing infection, right? And with that, then you can go get screened, practice safe sex, those who are injecting, stop injecting. Government needs to as well step in enforcement. But there is one area that perhaps should as well be talked about, where is sex education among children, among the youth, which for one reason or the other, religious institutions have said, no, our cultures as well, and also just our African culture the way we are, these are things that we just do not talk about. On that aspect alone, to just having conversations around it and making it a normal conversation, how would that be a game changer when it comes to addressing the burden?
It will be a game changer. But I've said you need to know how to approach it.
Yes.
Maybe use the religious leaders, especially communities who probably they won't want a lady to address a congregation of men about sexuality. But those are realities which are with us. And hepatitis doesn't know barriers. It doesn't know religion. It doesn't know tribe or ethnicity. It affects everyone so long as you're exposed. So I think it's prudent for everyone, starting with our teachers, our healthcare workers, the community, the clergy, and everyone, to be freely talking about the transmission of hepatitis and sexuality and what you can do, not to stop sex, but to have a safe sex.
Yeah. Another thing that happens is you have your partner, you want to get married. First thing, go test for HIV, and it remains there. But people don't take further.